place on Friday in Sunkani, headquarters of Ardokola local government area, one of the LGAs where cases of Lassa fever have been reported aside Beli and Jalingo local governments. Our correspondent was there and now reports. The training is designed to enhance community awareness and risk communication through use of information education, communication materials, and targeted outreach campaigns. Other objectives of the training include establishing community-based surveillance and referral systems for timely detection and management of suspected Lassa fever cases, as well as promoting environmental hygiene through organized cleanup exercise in sensitizing public on best practices to reduce transmission risk. The health body encouraged people to keep their environment clean, store food in tightly covered containers, and dispose of garbage properly to prevent rats from breeding around homes. In addition, people were also encouraged to report symptoms such as persistent fever, weakness, and unexplained bleeding to the nearest health facility for early diagnosis and treatments. In his remarks, the director of the Taraba State Primary Healthcare Development Agency, Mr. Lawan Iliasu, commended World Health Organization and its partners for the initiative. He urged participants to take the message of prevention and awareness back to their communities, noting that community-level engagement remain critical in stopping the disease. Participants expressed appreciation for the training, pointing out that the dry season when Lassa fever cases are often prevalent is approaching, making the knowledge timely and valuable. The initiative is part of the ongoing efforts to reduce the incidence of Lassa fever in Taraba State and Nigeria at large, where the disease continues to pose a public health challenge. Christiana Babayo, Haske News. In our next report, the Bauchi state government has disclosed that the new outbreak of cholera across 14 and 20 local government areas, 14 out of 20 local government areas in the state has claimed 58 lives. The Deputy Governor, Awal Jatau, who disclosed this during the inauguration of the State Cholera Steering Committee and the State Technical Working Committee, also said the state has 258 new cases of the disease. Our correspondent Abdulaziz Inua filed in this report.
According to Jatau, cholera remains one of the major public health threats despite the state government's effort to tackle the disease. He said these outbreaks are often preventable with timely interventions, coordinated responses, and sustained improvements in water, sanitation, and hygiene. And Bauchi State has now recorded not less than 258 new cases and 58 fatalities. He explained that the establishment of the Cholera Steering Committee is essential in achieving the desired objectives. The deputy added that the committee is expected to serve as the central coordinating body to lead Bauchi State's multi-sectoral response to cholera outbreaks and to drive long-term prevention strategies in alignment with the National Cholera Control Plan and the broader goals of the Nigerian Center for Disease Control and Prevention. Abdulaziz Muhammad Inwa, Haske News.
The National